This is Simon. He's with the California Behavioral Planning Council. And he's going to give us an update from the Planning Council.
Thank you, Teresa. Good afternoon. My name is Simon. I'm a behavioral health analyst with the California Behavioral Health Planning Council. And I'm happy to be here today to provide an update from each of our committee meetings held this week. And so I can go ahead and get started. The first committee is the System and Medicaid Committee. This committee has had a productive session focused on the implementation of SB Senate Bill 43, which expands the definition of grade disability. The committee received a presentation from the County Behavioral Health Directors Association, in which they provide an overview of SB 43. Members also engage with Sutter Health and San Francisco County Department of Public Health to hear about their experiences implementing SB 43. Next is Workforce and Employment Committee. The Department of Healthcare Access and Information, HCI, share findings from the summer 2025 Workforce and Education Training stakeholder sessions that they held over the summer. And some of the findings include ongoing stigma, inadequate clinical training, burnout as key workforce challenges. And so HCI plans to have their first draft completed and reviewed by the Planning Council in January 2026. Review and approval of the final draft will be in June 2026 of next year. And so last but not least, our interim chairperson presented on integrating individual placement and support, IPS, into substance use disorder treatment program, which sparks discussion on how the committee can support employment as a component, of recovery for the SUD population. And so next committee is Performance Outcome Committee. POC has been preparing upcoming events. For example, the committee is hosting a webinar, Homelessness in the Public Behavioral Health System, on December 4 from 10 a.m. to 11 a.m. Chairperson Noel will facilitate with presentation from Susan Wilson and also Samantha Spengler. And they'll share findings from the 5-year data notebook analysis and also from the 2024 followed by a Q&A session. And so we'll make sure to share that information with Teresa to share with the entire group. In addition, the 2025 data notebook survey on wellness and recovery centers is currently open with a submission deadline of November 1st. Planning is underway for the 2026 data notebook, which will focus on wellness and recovery programs for youth. Oh, good question.
I thought Noel said it was going to be.
Oh, you don't have a microphone.
I'm sorry.
There you go.
I thought Noel indicated that the date for submission was the 14th. So I'm just. November 14th. He changed it.
Okay.
Yeah.
Okay. Thank you for the correction.
Which is good because we won't have it by the 1st.
And then Dr. Stephen Eldersheim from Stanford Center for Youth Mental Health and Wellbeing, they presented on the ALCO Youth Center. They provided valuable insight for the 2026 data notebook. And so again, we'll make sure to provide the information to Teresa to share with the entire group. The next committee is Patient Rights Committee. They focus on strategic planning and advocacy. They are updating their work plan for 2026 and setting priorities for next year. And that include becoming more responsive to behavioral health legislation impacting patients' rights, as well as addressing staffing shortages for patient rights advocates, and also integrating SUD patient rights into the work plan. They also discussed concerns and issues around the federal executive order on crime and disorder. They have taken no action at this time, but the committee will monitor its potential impact on patient rights in California. And the next committee is Housing and Homelessness Committee. The committee review its charters, work plan for 2026, and also have identified some key goals and activities and areas of focus such as recovery housing, tracking housing and homelessness legislation, and also monitoring the federal executive order on homelessness and also its implication. Members also heard from two organizations. The first one is the San Francisco Department of Homelessness Supported Housing. They came to provide an overview of their rapid housing program. And the second organization, the California Interagency on Homelessness, they provided an overview of their guidance on recovering housing and housing first. And then moving on to the next committee is the Legislation and Public Policy Committee. The committee discussed potential policy priorities for 2026, and that include early intervention for individuals experiencing first episode of psychosis, as well as legislative and advocacy partnership with state partners, community partners, and the Disability Right California, they provided a presentation on the potential impact of proposed federal Medicaid cuts under HR 1, also known as the One Big Beautiful Bill Act. And then also talk about the federal executive order, the Ending Crime and Disorder on American Streets. And then the Department of Healthcare Services, EHCS, they provided an overview of California's harm reduction strategies and their successes in reducing overdose rates in California. And so that concludes the committee update. Happy to, I know that was a lot of information to absorb, so I'm happy to share my notes with Teresa to share with the group here. Yeah.
Yeah, thank you, Simon. Are there any questions online or in the room?
And I see some familiar faces too, so. Yeah.
Oh. Oh.
Thank you, Simon, for your presentation. A question that I've now forgotten. Oh, no, the Alcove Youth Center at Stanford. Is your organization working with them, or you're just aware of their program?
So the public health community, entitled a presenter, we're going to talk about some of their work and preparation for the next 2026 notebook. And so they can public presentation. And if you're interested, I'm happy to forward you the presentation when you provide.
That would be great, because San Francisco is very interested in getting more transitional age youth involved in our work. So that would, and I've heard about their program many years ago.
Oh, you need a mic.
I don't even need to say this. The gentleman's bio is on the Planning Council website. So if you were interested, or else one of us can get it to you who was there. Yeah, it was very interesting.
Thank you also, Simon, for your presentation, and thank the Planning Council for making their staff available to give us an update. I think it's vital that we all get an update on forth. I did have a comment. I'd like to make mention that the data notebook, Noel O'Neill, he's the chair of it now. Had a conversation with him in the past. I'm noting this for everyone that's on the advisory board. The Planning Council had made their tool somewhat difficult and difficult to maneuver through it, and through our input and so forth, they actually simplified it, which I've got to say that this year's was pretty simplified. I did have a couple comments, and I don't know how you guys feel about it, to Noel, and I shared that with him. I thought, because we use that tool, that survey, as a learning tool for some of our newer members, gets them immersed in the issues, particularly in one particular one, and gets them involved too, instead of sitting on the sidelines and so forth. So, and utilizing that, in the past, I noticed some of the topics that the Planning Council gave us actually had some background information, like, where the state is and what stats were and, the different views and data of different counties and so forth. I thought that was absent from this one. And I think that's very vitally necessary, particularly if we're using it as a learning tool for our new ones, but also for us veterans that have done it for a while. It allows us to see the perspective of where we sit in our county and kind of go forward with it and asking more questions and digging deeper to our county behavioral health. So that was one of the comments that I had. I want to make one note. I was wondering if there was any discussion on, with the immigration push and so forth, if there was any discussion, the planning council was taking on the issue in regards to how they're dealing with that statewide, because I mean, you can see there's an effect to where we're reversing back and not having people come forward and getting the services, hesitant to do so. Just kind of curious about that aspect of it.
Appreciate your comment. I definitely will take that back to the community staffer and to the team to share with them. And then regarding your second point regarding immigration, Jenny.
So we typically provide updates on the committees, not on our work groups, but we do have a reducing disparities work group. That work group has been discussing that for the last couple of meetings. They did make some recommendations on some fairly simple things that we can do as a council to support and educate on that. And one of the recommendations that I think we'll start at the next meeting is to have they're called the red cards, right? That information that we can have at our meetings at least. And then they're continuing to talk about and will make recommendations to us on ways that we can kind of educate and support in that area. It is something that some of our members are watching and are concerned about.
And Jenny, you or Simon can answer this. We have a number of people that are probably listening in that are new members. Maybe just a short definition of the data notebook.
Oh, sure. Do you want to do it or do you want me to do it?
What is the data notebook?
So the data notebook is something that the council has done annually. It is in response to the code that says that the mental health boards can provide to us information on performance outcomes statewide. We recognize that they're not everything we address isn't necessarily a performance outcome. We are moving in that direction with assistance from Teresa, but it is a way that we gather information from the mental health boards about different topics each year under the public behavioral health system. And then we do a report that then is distributed to you all. And also we do send it to the legislature, to the department, and to other agencies to share this information.